It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
How would you like to have sharp, clear vision? How would you like to not be wearing glasses or contacts with a very high prescription? Well, that would be the EVO ICL. And Dr. James Kelly is here with us to talk about it. Dr. Kelly, how are you today?
I'm doing well, Steve. Thank you for having me.
Before we do anything, I have to say congratulations on being the first certified EVO ICL surgeon in New York. That's phenomenal.
Thank you. It's a real honor for me. I'm very excited to be the first one certified on this great new technology.
So let's get right into it. What does ICL stand for?
So ICL is an acronym for implantable contact lens. And basically what it is, it's a miniature version of the contact lenses that everyone's kind of used to. And instead of being applied to the outside of the eye, it's inserted inside the eye and it remains there permanently.
What makes it so revolutionary? Why is everybody talking about it right now?
Well, it is revolutionary because we're able to help people with really high prescriptions who otherwise would not be candidates for other forms of vision correction surgery like LASIK or PRK or SMILE. So these are patients, many of whom are contact lens intolerant, some of whom have these glasses that are like Coke bottles, are super thick. And this is an option for them that did not exist before. So it is a godsend for those types of patients.
So I've also heard that you have great night vision with it, which sometimes can be challenging with some other procedures, but it's not the case with the EVO. Yeah,
so night vision disturbances are intrinsic in the functioning of the human eye, even for people who have naturally good vision. We have glare and halos at night when we wear glasses and contacts. And the traditional forms of laser vision correction, which are LASIK, PRK, and SMILE, were known from the beginning to have some night vision disturbances. We see far fewer of them now as the technology gets better, but nonetheless, there are still night vision disturbances with those. They get better over time. I had LASIK on my own eyes about 23 years ago, and for the first several months, I did have some glare and halos more than I did with my contacts and glasses, and it got better. But with this new EVO ICL, EVO is actually short for evolution. We see far fewer night vision disturbances. Sometimes in the early period, the first few weeks or even a couple of months, patients will describe some glare or haloing or starbursting at night, but it gradually goes away, and they describe being able to drive at night for the first time in their life, really.
It's amazing. And by the way, we keep saying new, but the EVO or EVO ICL has been around for a while.
Yeah, well, it has. So worldwide, it's been around for many years. And its predecessor lens, the Visian ICL, has been around for 15 years now. In many countries around the world, it's a very commonly performed procedure. The FDA recently approved the EVO, the new generation ICL, for the United States. So we're excited. We want to catch up to our colleagues around the world who have been able to place these in their patients' eyes, and we want our patients to be as happy as those patients.
It's great that it's been proven, it's been tested, and I know that there's a lot of consideration for somebody that wears contact lenses about dry eye. You get that a lot, you have to take the drops out, but that's not a real consideration with the EVO.
That's right. And that's one of the more exciting parts of it, is that the EVO lens, the evolution lens, goes inside the eye. So we're not disturbing the part of the eye, the cornea, that is in many ways responsible for keeping the eye lubricated. So we're bypassing that part of the anatomy. So patients who have the original version, the Visian ICL and the EVO, have described almost no increased dryness after the procedure. Sometimes for a few days, they may notice a little scratchiness, but we're excited to tell patients who have dry eye that they still could be a great candidate for this technology. You know, it's interesting, Steve. A lot of the reason patients have difficulty with contact lenses is because of dryness or allergies. And so I'm often asked, well, will I get these same types of problems with the ICL? And I tell them no. And they're like, well, why? And I said, it's because it's inside the eye and it's not subject to dryness or external allergens that would cause these symptoms. So it's something that's an improvement over contact lenses in that way alone.
What about the candidate, the perfect person that should get an EVO or EVO ICL?
So a candidate between around the ages of 21 to about 44, 45 years of age who has healthy eyes in general. They're free of any major medical conditions. We look for people whose prescriptions have been stable for at least a year or more. We also measure the anatomy of the eye. So we look at the size of the eye, we look at the curvature within the eye, and they have to pass certain anatomic criteria in order to be eligible. And we do a very careful consultation in the office, and we determine whether or not those measurements are satisfied. And in most cases, patients are, they have the anatomy that's necessary for a good result. We're excited when that happens. So that's what we're looking for in terms of a good candidate.
So what about recovery time? Because we're all thinking about that. We have busy lives. We go in for the procedure. How long would it take for us to be back, call it normal?
Okay, so I get asked this quite frequently, and I tell patients they have the option of doing one eye at a time or both eyes during the same session. The vast majority of people choose to do both eyes at the same time. And I tell those patients that the day after the procedure, they can use a computer, they could watch TV, they could use a cell phone. We do ask that they wear protective goggles for the first 24 hours so that they don't inadvertently rub their eye. There's some minor restrictions for the first week or two in terms of heavy lifting. Most patients can drive 24 hours later, so it's nice. They don't need to have someone drive for them. Just the day of the procedure, we ask that someone drive them back from the procedure, but they can resume their normal activities usually within a day.
So you mentioned protection of your eyes so you don't touch your eyes. So we're all doing that. We're always scratching. When we say protection, right away comes to my mind UV protection, which is actually really good with the EVO.
Yeah, so it's like having a built-in UV filter. So we always talk to patients about, let's protect your eyes from cataract formation, from macular degeneration, from skin cancer around the eye. And certainly from the standpoint of cataracts and macular degeneration, the UV protection that's built into the EVO lens is something that's an added protective benefit for patients. So they have a built-in UV filter right in their eye, and it's something that can potentially decrease the formation of macular degeneration.
Does that mean you don't need to wear sunglasses?
Sunglasses are still I think something that I recommend in most of my colleagues because it does protect the skin around the eye, which wouldn't be protected by the EVO lens. So and sometimes patients will have light sensitivity naturally with or without the ICL, the EVO in their eye. So I'm a fan of advocating sunglasses for my patients.
So one thing we didn't hit upon, but I'm really curious about the procedure. How long does it take?
So the procedure itself, the actual time I'm doing the procedure in the person's eye is about 10 minutes for each eye. There's a period of preparation before, during, and afterwards. There's several steps that have to be taken in terms of maintaining sterility. So the whole time the person's in the procedure room is about 30, 35 minutes, but it's actually just about 5 to 10 minutes per eye that I'm doing something.
That's pretty amazing.
A lifetime of wearing glasses and or contact lenses that are eliminated in a matter of minutes.
And for a lot of people that can have, I would assume, laser correction because maybe they have a thin cornea or there's some other issues, then the EVO ICL would be an answer.
Absolutely. I can't tell you how many times patients have come into my office and they've said, look, they sort of have this despondent look on their eye. They're like, I'm just here for another opinion. I know you're probably going to say I'm not a candidate because I was told I'm not a good LASIK candidate by 1 or 2 or 3 other doctors. And we'll do all those measurements that I mentioned earlier. And in most cases, they are a candidate for the ICL. So I mentioned this technology to them and their first response is kind of, you're kidding. Like, I can't believe it. How come I didn't know about this before? Why didn't anyone say this? But I'm really happy that there is something that could help me. So what I do is I go through an educational process with the patient in the office. I ask them to do some of their own research online. Go to various different websites. Star Surgical, which is the manufacturer of the ICL, has a lot of very important patient information and education on their website. Then I tell the patients, come back with all this information and ask me questions. And in many cases, they'll come back with a list of questions, and I'll go through the answers with them. And they're just so excited to schedule their surgery at that point.
You seem so excited. Your passion just comes through because it sounds like you have another tool, another option to help people. And that's how you're wired. That's why you're here.
That's why I do what I do. I'll tell you, one of the most exciting surgeries I do, if not the most exciting surgery I do, and I do a number of different surgeries, is the ICL surgery. And I'll tell you what really gets to me in such a profound, impactful way is that I wind up placing the ICL in most cases in both eyes, and then the patient sits up from the lying down position on the surgery bed, and they look around. We have a clock on the wall, and they see the time, and they look around. They see the faces of the people in the operating room, and they start crying, and it's a very emotional moment. And even though this happened to me a number of times, I try to hold back the tears myself, and it's hard because you see the joy on their face and the jubilation, and it's infectious for everyone in the operating room.
I have goosebumps just hearing you say that because it's so life-changing for somebody. And just a 5 to 10 minute procedure, why wouldn't you do it if you're a candidate for the EVO ICL, right?
Yeah, no, I tell patients it's certainly an investment. The investment has many parts to it, but you don't have to wear glasses or contacts anymore, so you save the money there. It's something we work with financing companies and try to make the procedure affordable for patients. And we know that it's something that there's over a 99.5% satisfaction rate where people who had this done would do it again. So 99.6%, something like that, and a lot of patients will come back to me and say, I am so happy I did this. And why the heck didn't I do this sooner? Why didn't I know about this? So while they're overjoyed having had the procedure, they're almost regretful that they didn't do it sooner. But I said, it's all about looking forward. You have great vision now, and pass the word on to other people that may benefit from this.
Well, that's why we're talking about it today. And it is the biggest city in the world, New York City. And just knowing that it's available and that you are the first certified EVO ICL surgeon is just fantastic. And Dr. James Kelly, thanks for being with us today.
Thank you, Steve.
It's better vision for life with board-certified ophthalmologist Dr. James Kelly.
Learn more at kellylaser.com.